Welcome to another episode of Easy Access to Healthcare for All, a program which brings you news and issues around the National Health Insurance Authority as it drives Nigeria towards universal health coverage. The NHIA Leadership Development Program, NLDP, is a strategic capacity building program for staff. It is part of the reforms going on in the NHIA that will put it on the trajectory of achieving universal health coverage as well as develop leadership and skills for staff of the authority. It is along this line that a 3-day training was recently organized for newly appointed state coordinators as well as other key officers within the authority. We will take you through this 3-day workshop to look at the content and objective of the training. We shall also take the opinions of participants at the training as part of our stakeholders segment. All of these when the program commences. I am your regular anchor, Aisha Muhammad Ahmed. Please stay tuned.
GIFSHIP moves, leaving no one behind. GIFSHIP moves, leaving no one behind. GIFSHIP moves, leaving no one behind. GIFSHIP moves, leaving no one behind.
First on the program is a highlight of events around the NHIA. In the news, NHIA holds session with Innovative Financing Technical Committee just as NHIA sensitizes enrollees of National Biotechnology Development Agency. Please stay tuned for the news updates.
Please may kindly take the weight of your views.
The National Health Insurance Authority on Tuesday 18th April 2023 held a technical session with the Committee on Innovative Financing, inaugurated to enable it design a workable framework for achieving universal health coverage. Members of the committee are drawn from development partners, government agencies and parastatals across the nation.
For the purpose of attainment of universal health coverage through the National Health Insurance.
Professor Nasir Mohammed Sambo, Director General, National Health Insurance Authority, commended the committee for dedication so far, while urging them to give in their best for the success of this project.
I had the opportunity to browse about on the framework that has been developed, and I was very fascinated with the picture of the framework and the amount of work that has gone into it so far. And I want to crave the indulgence of the members to continue to work hard. It is not over until it is over. And I believe that at the end of the day, we will bring a document that we will all be happy with it. Today's occasion is going to be very rigorous because thematic groups are going to make presentations. And it is expected that everybody in the room should listen to the presentation and try as much as possible to make inputs, so that at the end of the day, the product that is coming will be collectively owned by all the people that have participated.
Also speaking at the event, Modupe Ogundimu, General Manager Contributions Management, NHIA, said the session was an avenue to compile ideas that will help the authority raise funds with a framework that will sustain it.
Well, this session was basically to compile ideas on how to generate more funding for health, particularly for the Vulnerable Group Fund, which is enshrined in the new NHIA Act. And so we had different groups looking at different means of garnering more funds for health, and also to come up with some kind of accountability framework so that we know, we're able to track those funds appropriately. We had loads of ideas that came on board, and I think by the time we compile them, articulate them, and put together a report, we'll almost have, we will definitely have an investment case for getting those funds for the Vulnerable Group Fund so that we can actually meet the health needs of the vulnerables.
The meeting had presentations from International Labour Organization ILO, UNICEF, and the World Bank.
We are using the multidimensional poverty index.
You pay GIFSHIP for your child. Government will not pay again.
The NHIA recently visited the National Biotechnology Development Agency. The visit was to sensitize staff of the agency on health insurance and new trends within the health insurance space. Emmanuel Ononokono, Acting General Manager, Media and Public Relations, led the team for the sensitization exercise.
I have one job in the authority, to preach the gospel according to health insurance.
He enlightened the audience on the importance of health insurance, the new NHIA Act, and why the old Act was repealed.
Research has shown that each time people spend out of pocket for healthcare, they open wide the doors of poverty. If you spend out of pocket. So all over the world, especially in the developed world, there's what you call health insurance. If you were to travel to Europe right now, you'll be required to have it. And so from the 19th of May, the President signed the NHIA Act into law, making health insurance mandatory. It's no longer optional. So before long, you're going to go to the bank to transact, and if you do not have health insurance, you can't have your money. But for everyone in this room, you don't have a problem. You are paid for by federal government. But many people are unaware. That's why we are here today.
Mr. Ononokono further ran through the rights and privileges of enrollees, as well as the NHIA benefit package, with special reference to the NHIA flagship program known as GIFSHIP.
Benefit package. You have the benefit package with you. I showed you. You see it there, benefit package. Now that benefit package is a summary. Is a summary of the things that you are entitled to at the hospital, from primary level of care to secondary to tertiary. Deliveries, all forms of deliveries, and postnatal care. And that child is entitled to 12 weeks of care before that child is included in the system without pay.
At the end, there was a question and answer session.
Welcome back. With the emergence of this new NHIA came the need for endless capacity building for key officers within the authority. The aim was simple, and that is to bring every stakeholder and staff on board towards the attainment of the authority's mandates. In our next segment, Issues Around the NHIA, we shall see how the authority is exploring its leadership program known as the NHIA Leadership Development Program to help build the leadership skills of its newly appointed state coordinators in a 3-day program held at the Enterprise Development Center in Lagos. Stay tuned as we take you through the activities of the 3-day workshop in our next segment, Issues Around the NHIA.
You're going to be asking yourself questions. Why? You keep asking.
In 2022, the NHIA, in partnership with Result for Development, created the NHIA, a leadership development training modules for top management staff of the authority. The training was later organized for CEOs of state social health insurance agencies, all in the effort of the leadership to build capacity of key officers within the health insurance space. The NHIA Leadership Development Program, NLDP, is a new initiative of the present leadership of the National Health Insurance Authority, which has introduced to help develop requisite skills and competencies of the senior and management staff of NHIA as a result of the ongoing transformation in the organization. To further strengthen this program, the NHIA signed a tripartite Memorandum of Understanding between R4D, NHIA, and NLDP training institutions in August 2022. Furthering the objective of the partnership, the NHIA held the 4th cohort for newly appointed state coordinators and heads of departments of the agency in Lagos. The event started with a welcome address by Professor Nasir Mohammed Sambo, who was represented by Mr. Olufemi Akingbade. He said the authority is doing so much in grooming leaders and therefore urged participants to embrace the training program and maximize the opportunities to deliver on their mandate.
NHIA in recent times has done a lot to make sure that as you are coming into leadership positions, you are well trained to be able to take that position to a greater height. And NHIA has done so much. One of it is this strategic partnership with EDC to be able to train leaders. Also, we have other partnerships. You know what the new DG is advocating for. There's a universal health coverage that we're looking at, and in achieving that, we have actually adopted what we call health insurance under one roof also. This is the 4th cohort of this program. The top management has been here. Other state coordinators has been here. Most of you are new state coordinators. That's why you are just coming here. We've also had this program for the chief executives of the state health insurance agencies across Nigeria. They have been here too. And this is the 4th cohort of this program. I want to welcome each and every one of you. I want you, just like I said, to be able to open up your mind. We have so much to learn.
Dr. Hope Uweja, Country Director of Result for Development, R4D, in his opening remarks, said the task ahead of the new NHIA demands that officers at the helm of affairs are well equipped with leadership skills to help them deliver on their mandate.
The NHIS has been positioned to drive universal health coverage in Nigeria. If you look at the population of Nigeria, for every 5 Africans, 1 is a Nigerian. And if we don't get it right in Nigeria, we hardly can get it right in Africa. And so the whole world is looking towards Nigeria, and the whole world is looking towards NHIA to make the big difference. Luckily for us, we have a DG who has the historical memory, who has the experience both inside, outside, academics, non-academics, etc. in position now and making all efforts. He cannot succeed, we cannot succeed if the building blocks, who are the keys, middle and senior level staff in NHIA, are not properly positioned to be able to deliver on this mandate.
The event was packed with several training classes, interactive sessions, and breakout sessions. The class on emotional intelligence was facilitated with a team activity by the Deputy Director of EDC, Mrs. Neka Okekearu.
All of us are so different. So I might be hearing what you're telling me, but what I'm understanding from it is different, which is why the onus is on you as a leader to constantly ask. See, since we started, how many times have I asked you any comments, any reaction? So I've made it open. Why? Because you might not be understanding what I'm saying. I might be speaking too fast. I might not be making sense. I might be using words that you don't know. Okay? So it's the same thing for us as leaders. We need to open up ourselves and understand fully what is happening. And the minute we do that, there's no way. You'll be more efficient, you'll be more effective in the workplace. Okay?
Ikaite Augustine added, a personal trainer and a consultant, gave a presentation on team building while she outlined the concept of teams, as well as the team building process, characteristics of effective teams, and stages of team building, among others.
There must be discussion of goals, especially with coaching.
There was another interesting presentation on performance management, which was anchored by Jonathan Obinna.
Another reason to manage performance is to have a motivated workforce, meaning that everybody has to be aligned. Everybody has to be aligned with what is going on. One way to create a culture where you have everybody working in the same direction is to have a shared sense of purpose. I'm sure you've done that. I stumbled on it, like you were having a leadership class this morning. So it also has its impact in terms of morale, when everyone knows what we are trying to achieve. In fact, the basis upon even recruiting sometimes is to say, look, this is what this organization is about. this is where we are headed. So you want to ensure that even from day one, while the person is coming in, that is why, remember I said that performance management involves anything and everything that allows you to achieve your objective. Even recruitment, HR is part of the performance management system in an organization.
Some of the other topics treated include 9 basic steps of consulting, EDC experience, performance management for corporate excellence, leadership and leadership styles, coaching and mentoring for institutions, change management, and several other topics treated in breakout sessions. The training program came to an end with the presentation of certificates to participants. In summary, NHIA Ume, NLDP program manager, in an interview sheds more light on the program, how far it came, and what it intends to achieve.
For the NLDP started about 2 years ago, and like you rightly said, this is the 4th cohort. We have had the top management, the state coordinators, the CEOs of state health insurance agencies, and now because we had a new set of state coordinators and some other members of the staff of the authority who have moved into leadership positions. So that was why we now have this 4th cohort. And so the NLDP is not an end in itself. As we're having this cohort, we're also liaising with our partner institutions, and we're going to be producing modules so that we can have more access to more people for the NLDP. Apart from that, we are also planning to transition the NLDP into an Institute for Universal Health, which will also later transition into a University for Universal Health. So it's a very large and ambitious legacy project that will serve not just NHIA, but also other stakeholders in the health insurance industry.
Welcome back. In our stakeholders segment, we'll bring you perceptions of participants at the NHIA Leadership Development Program. They speak on the impact of the program and how it will help shape them on how to carry on when they return to their various offices.
I'm new in Ogun State, but I've not been taking measurement of performance. I was telling the TA that even from my cleaner, the HR will have to develop a tool to measure how efficient or how proper they've done their job. That I'm taking from here. Talking about mentorship, I would love my HODs to be mentors to people under them, even if it's on the job alone. And they're talking about brainstorming. When I came, all we normally do is, let's know you. I'm in this department, my name is this. But from what I've learned here, I need to know more about my team. And when I get back, I'm going to do that to know personal things that will make us work more efficiently.
I remember when we came in 3 days ago and we were told to leave all our knowledge out there. It sounded like a fairy tale. But right now it's making a lot of sense that irrespective of whatever we thought we knew, yeah, we are still a lot to learn. For me personally, I have been under the perception that whenever a staff, a colleague, is not showing interest on the job, it is okay to leave him. Maybe that's how he wants to live his own life. But that's a wrong concept. So what I now need to do, especially from my learnings in team building, coaching and mentoring, is to sit down with him and even understand what his or her problems are in order to assist him or her to develop on the job and to become more productive.
What I've learned is, number one, to always put myself in the shoes of the people I'm leading. Number two, checklists. I observed when I resumed in my state office that the office assistant doesn't know what she has to do. You have to tell her, do like this, do like that, do like that. So there's no laid down things for her to do. So with this now, what I said is that when I go back, I'll do a checklist for her so that when she comes in the morning, she knows what to do. So I'm going to put a checklist for her, and I'm going to also talk to other staff to try and see if they can put a checklist for themselves, like an SOP for their departments, and we are going to look at it and make sure that everything is going on well, and they are able to also transfer knowledge from themselves that are head of divisions to their subordinates.
As I'm going now, I've been able to even evaluate myself, and I have discovered a lot of things ordinarily that I was not considering about myself, because I have to study myself before I can actually evaluate others. So I've already gotten the key to actually assess my team as I go home, because what I had here now is direct opposite of how I have been brought up in the National Health Insurance Authority. The type of leadership that I have been tutored in the NHIA over the 15 years is in total contrast to what I have been taught here now. And like Dr. Kenneth said, that when we're coming, the first lecture we had, he said, whatever your impression is, whatever you have, just drop it there, and then to be able to get another opportunity of reorientation. I have been greatly reoriented.
Some of the participants commended the management of NHIA for this initiative.
The effort of the management of the NHIA, is supposed to be very highly commended. This is among the training since I started in NHIA, and that's approximately 23 years now, that I've attended a training that has direct impact with what I'm supposed to be doing. And truly, first of all, looking at the mirror and telling yourself the truth about yourself and the things that need real change.
I'm very grateful to the manager of NHIA. Actually, what we are seeing now is real change management in practice. We are here as NHI's coordinators and co, and we are going back as different people. Change, fully schooled, well trained, well facilitated, and we are ready to disseminate information down there.
We will now take your questions in this last segment of the program.
Where do I register? How can I get enrolled? Where do I register? How can I get enrolled? How can I get enrolled?
Question: what is the GIFSHIP program?
It is supposed to be an all-encompassing program that will cover G group of people, I individual, and F family, who are not employed within the formal sector, but they are either employees of the informal sector or they are self-employed, provided they are earning salaries, they are earning income, and that income is sufficient enough to pay premium and get into the social health insurance ecosystem.
And so, we draw the curtains on this week's episode of the program. The NHIA is leaving no stone unturned to see that it fulfills its mandate to Nigerians. Join us every week as we continue to bring you updates on more of its activities and strategies as it marches towards universal health coverage. See you next week.